Well, I'm really excited that you guys had the chance to join us for a special unconventional call for jackcruise.com. Many of you guys know Gretchen, also known as Shinjin. Is that right? Am I butchering your forum name?
Yes.
You guys probably know her from a lot of the comments that Jack has made on other webinars and Q&As. She's commented a lot on some of the blog posts that Jack has written for us, and she's very, very active in the forum. So you should definitely recall some of the stuff that she's talked about in the forums. She actually has a blog post on the site. Gretchen, I don't know if you know where that blog post is, but if you wanted to share a link, that might be kind of cool for some people who may have missed that post because it's been a little bit. But she actually has a post on the site, and she's also got some pretty epic threads over there in the forum breaking down a lot of the stuff that she's been able to piece together to kind of hack herself and her family and get some help with her own health issues. So she's been an inspiration to a lot of us, and she's kind of by necessity, I think we could say, turned into quite the great lab hack herself. She's done tons of research, and she's really figured out how to connect some important dots and get the help that she needs from her doctor. So I'm stoked that we are able to do this webinar for you guys today. And without further ado, Gretchen, I would love for you to say hi to everyone. And why don't you start off? I mean, there's so many things that we can talk about, and I'm even looking over some bullet points that you and I put together ahead of time, and I'm feeling almost overwhelmed that we have to cram all of this into probably about a 90-minute webinar. But I do want to touch on a lot of things. I think it's really important for people to understand your health history and some of the things that you were dealing with before you started kind of turning a corner and taking matters into your own hands, because I know we have a ton of people in our community who have dealt with a lot of the same issues that you have, especially the women in the community. So I want them to kind of be able to follow your journey and see themselves in some of the major things that you've had to deal with, so that they know what they can extrapolate from the things that you're doing to get help for themselves. So I think that would be a great place to start. Why don't you tell us a little bit about your background? And interestingly, we're going to talk about both finding a doctor and getting labs paid for by insurance on this webinar. And Gretchen actually started out in the VA system, Veterans Administration system. Is that what they call it, Gretchen? VA system? So she was basically working in a very less than ideal environment to start getting some help. But she's got some great takeaways for all of us, and I'm so excited for you to be sharing with us, Gretchen. So why don't you start with a little bit of your backstory?
Well, my medical history goes all the way back to when I was a child. I had my first asthma attack when I was like 4 or 5. We lived in Kansas City, and it continued to progress and got worse. Moved to California, and then got even worse when we moved to Chicago. Around the age of 10, I had my first migraine, and I didn't respond to the normal treatments you would give for migraines. I actually had to be taken to an emergency room, and my dad's attending physician had to treat me. They actually had to strap me down and give me Tylenol with codeine, and he instructed me to close my eyes and not move, which was insanely hard because the Tylenol with codeine made me extremely hyper. And so I've been dealing with asthma and migraines pretty much, for 30 years now.
Math is an
And I can't do math.
It doesn't matter.
And I've been on a bunch of different things, a bunch of different drugs to try to manage my migraines, to manage my asthma, and I don't respond to them like the doctors and the clinical trials say I should. For college, I went to the United States Air Force Academy, graduated, no issues, still having migraines, still having asthma, but they continued to get worse. The one place I lived where I didn't have them as, I didn't have as many problems was when I lived in Guam. But when I moved to Okinawa, they continued to move forward, and everything continued to get worse. So I got out, of the Air Force. It was a medical separation. I wasn't entirely happy with that choice that was forced upon me. So I entered the VA system, and what happened is they went through, did a battery of tests, basically looked at me and said, well, you may have asthma, but you don't have asthma. And the only thing we can give you for your migraines will also be something we'll give you for your bipolar disorder. I'm like, wait a minute, I'm bipolar? They're like, yeah, you're bipolar. These are examples of bipolarism.
Now, were they telling you that you were bipolar because of something they were seeing in your labs, or were they telling you that you were bipolar because of the symptoms? Like, were you? Go ahead.
They were saying because of the symptoms, because I had a tendency to like to work night shifts, swing shifts. I didn't really function well in the day. My circadian clock was completely off. And so that became very challenging. So they lumped me in this, and it was challenging. Trying to figure out, what's going on. When you transition out of the military into the civilian world, there's not a lot of support for those people who are transitioning, especially those who had every intention to stay in, and it's not an option for you to stay in.
Were you complaining about some symptoms, and that's why they diagnosed you as bipolar?
Yeah, I think so, because I definitely had signs of depression, which is pretty much the norm when you lose the career you want to spend the rest of your life doing. When you're told you can't do what you wanted to do. So they put me on Depakote, they put me on Topamax, and they're like, this will treat the bipolar, and this will treat the migraines. And they're like, well, let's try you on Imitrex. Well, I tried Imitrex and some of the other Imitrex-like drugs about 10 years prior, and I said, they don't work for me, they make them worse. So I came in one night.
I'm sorry to interrupt. You had the migraine piece and the asthma piece, but when did some of these other health issues kind of start bubbling to the surface? Because you also have a PCOS diagnosis and several other things that are kind of off the path of those two.
Right. And, in the research that I've done, I've discovered that the migraines and the PCOS sometimes go hand in hand because it's that it's related to that estrogen dominance. And I've always, and the one thing about PCOS is you're estrogen dominant and you also have extra testosterone. I have always been the tom girl, no dresses, military was a perfect environment for me because I got to run around in jeans and boots and get dirty and play with things that made things go boom. I mean, it was my perfect place to work, given my tendencies. But the VA sat there and they looked at this and they're like, well, these things are going on. At that point, I was in the process of trying to lose weight. I had gained a lot of weight coming out of the military, related to depression, could have been related to a bunch of different things. I started eating a vegetarian-based diet, cut out meats, and things continued to decline. Ended up moving to Washington, D.C., got a job, and things just progressively got worse. At one point, they diagnosed me with fibromyalgia, chronic fatigue syndrome, and post-traumatic stress disorder.
So at what point did you say, this is ridiculous, and I've got to do something different. They're not helping me.
Well, I woke up one morning, got in the shower to get ready to go to work. And as I stepped in the shower, turned it on, I started burning from the inside out, literally. And it's hard to explain. I freaked out because having worked in the military, you understand what responses happen when you've been exposed to chemicals that are not necessarily good for humans. And my husband was out of town at the time. We were dating. And my roommates were all out of town. I was able to contact another friend who was on her way out of town. She was fortunately able to stop over. I could barely put clothes on me. I couldn't dry myself off. It hurt to touch my skin. It was so painful. I don't really know how to describe the pain, but it scared me immensely. My friend drove me to the VA in Washington, D.C. I got in there. I walked up to the front desk where I always go and check in. And the ladies knew me. They knew something was wrong because I was in tears, and they took me back. They're like, your doctor's not here today, but we've got a replacement for him, so we'll get you in with her right now. Well, she just looked at me and she goes, well, it's your fibromyalgia acting up. And I about had it. He said, listen, lady, you don't know what you're talking about. This is not fibromyalgia pain. I said, I feel like I'm burning from the inside out. I feel like my cells are on fire. And she just told me to take some Percocet and I'd be fine the next day. So I was extremely distraught, upset, in pain. So I walked up to the neurology department. And I'd seen the head neurologist there for the past 4 years at that point. And fortunately, the ladies who ran that desk knew me as well, and they took me straight back to see the doctor. And he looked at me. I gave him my symptoms, and he goes, you're having a toxic reaction to the medicine you're on for the migraines and the bipolar disorder. And hooked me up to an IV, set me in a room, and they flushed me out. And he said, you are off all medications. And he put in my file at the VA that I cannot be treated with any sort of antipsychotic, antidepressive medications because I have negative responses to them. And he basically told me at the end of the day when he got ready to leave, around 6 o'clock, and he was ready to let me go, he said, I can no longer help you. You have reached a point where you need to find someone who can. Here's the name of a chiropractor who does holistic healing. Start with him. The other thing I want you to do is I want you to go gluten-free and see if that helps. He goes, there's no reason for you to come back here except for your annual exams and just to maintain your VA status.
How did that feel?
Other than that,
a neurologist that, you've been getting, all these things are going on and he says, I can't help you. Did you feel liberated by that, or did you feel like abandoned?
well, I kind of was like, okay, well, I'm willing to try anything at this point. I'm willing to try anything. And he's like, the fact is like the only drug that works for you when you have a migraine is Excedrin migraine. The fact I can't write a prescription for you and have it work tells me you don't function the way normal people function. You are outside the norm. I'm supposed to be able to treat in the norm. The outliers, I don't know how to treat them because there's no treatment for them. You're going to have to find your own way.
Yeah.
So I started going to this chiropractor. He was very helpful. He's also where I started learning how to get labs paid for. In certain states, chiropractors are authorized to write labs prescriptions on a lab check. So you need to verify with your state. You also need to verify with your insurance company if they will cover orders written by chiropractors for labs. I know in the state of Virginia, United Healthcare will cover them and Blue Cross Blue Shield will cover them.
I think this is really interesting because I have a chiropractor here in town who, fresh out of med school, not fresh out of med school, he's probably 2 years out now, but at the time when I first met him, he was fresh out of med school and he was really into all the labs and stuff, doing the deeper hacks. And he is a Blue Cross Blue Shield chiropractor, and he used to get calls from Quest and a couple of the other lab processors here in town in Nashville, where I live. And they would tell him that they wanted him to send their patients to him and that Blue Cross Blue Shield would pay for the labs. They could help make sure that Blue Cross Blue Shield paid for the labs. And he was always kind of confounded by that because he didn't know if he had the authority basically to write a prescription for labs and then tell a patient that your insurance will pay for it. So as I've talked this through with you, Gretchen, I've kind of connected the dots a little bit in my head that you can't necessarily just rely on your provider to know and understand how your policies are going to handle different claims, like paying for labs. You can't, like Chad didn't even know, even though he's a preferred Blue Cross Blue Shield chiropractor, he didn't know that, in fact, he could write a prescription, and if he had the right codes, he could tell a patient that your insurance should pay for this, So this is a really, great point. I think that everyone should be taking notes and getting in touch with their provider. And I think that you can kind of frame this out a little bit more, Gretchen, so that they understand, actually how to go about it. But I think a lot of people that have struggled to get labs from their doctors could go find a great chiropractor. I mean, this is pretty common in the chiropractic world, the whole lab side of things. They could find a great chiropractor and ask their chiropractor to write a prescription for the labs. And the important thing is the codes, right?
Right. And that was one of the things that I discovered in this journey was that when I had my diagnosis codes, and they're called the ICD-9s, when I had those codes, I had everything I needed to give my chiropractor to fill out on the lab sheet to get my labs paid for.
Yeah.
And what I would do is I would contact Blue Cross Blue Shield when I had them, and I contacted United Healthcare when I had them, and I asked, my doctor wants to run the following labs. Will you cover them? I said, yeah, we'll cover them. I'm like, okay, what do you need? And they said, well, we need these ICD codes. And I'm like, okay, well, these, and I provided my codes back to them. I'm like, well, these codes work for these labs. And they came back and they said, yeah.
In your experience, you've called insurance companies to get this kind of information. Have they been pretty forthright and helpful in telling you, how to navigate things?
Usually what I do is I write a lot.
There's times we're just getting some feedback, and I think last time we tried, Gretchen's mic was awful, and now she's got like a rock star blow us out of the house mic. Go ahead.
Last time, when I interface with the insurance companies, I always write letters, whether it's a hard copy, traditional snail mail letter, or whether it's email. I always write letters because I want their response in writing, so that if I have to fight to appeal a claim, I have a way to do it. I have documentation to go back to the insurance company with. Right. And that's really important. That's one of the things that has helped me, is establishing a line of communication, keeping records of that communication, and that's what's helped me get things paid for. And I figured it out through trial by error. And my chiropractor, I tell him what I wanted to do, and he'd say, well, have the receptionist give you a chit. And she goes, well, what do you want me to fill out? And I'm like, I just sign it, and with his, have him sign the name, and I'll put the diagnosis codes in, and I will put the labs I want run. And I did that for 3-4 years with him. And it was great until I actually found a doctor who was willing to work with me.
When did you
eventually I found
yourself? Was that after you found the Jack community and that thread over at MDA, or was it before that?
I've been doing labs with the chiropractor for I started in 2004, so we would run labs every year, maybe more if I was not feeling well. And, obviously he can't write prescriptions, but, he can give me herbal remedies and homeopathic medicines. Sometimes they would work, sometimes they wouldn't. It was just touch and go, trying to figure out, how do you get from A to B and have someone help you get there. While I was still using the chiropractor, I was still using the VA as my primary care. Through the MDA thread, I finally figured out what labs I really needed to be running, not just, is it just a general thyroid panel? Is it a sex hormone panel. I got the whole shebang ran. And I took it into my VA doctor. And my VA doctor looked at me and she goes, yeah, looking at this testosterone level on your labs, you have PCOS. She's like, yeah, you're completely out of range. She's like, are you taking anything? And I'm like, no. She's like, ooh, yeah, I'm going to send you to the endocrinologist. Well, I got into the endocrinologist,
So this is
3
another
months
important
later.
distinction that I just want to highlight as you're talking about this, because sometimes the expectation is, if you could pull up your settings on your mic too and see if you can turn your mic down a little bit, Gretchen. Sometimes the expectation
Okay.
is that, you're going to go to a doctor and the doctor's going to order the labs and find out what's wrong, when in truth, sometimes you have to have the labs and take them to the doctor so they could see what's going on. And it would be nice in a perfect world if we, didn't have to do that, if we could get our doctors to order things, coming out of the gate. But I've heard a lot of stories, and in my own experience too, having the lab and the lab history when you go in to talk to doctors in the first place is really, really crucial. So I think a great path for those of you who have been struggling a bit on the lab side of things, I think a great path for you is to find a great chiropractor or find a great naturopath or functional medicine doctor who will order the labs and get the labs ordered. We do have posted somewhere on the site. I will have this sent out in an email to everyone after. Actually, one of the emails that we send out about the boot camp we're doing, I'll have them attach the optimal labs worksheet. But we do have a worksheet that has the optimal labs and optimal lab values that should really support you if you're just getting started out on this journey and you're trying to figure out, how do I get all this stuff paid for? Um, you can use this worksheet as a bit of a guidepost. These are the labs that I want ordered, and whenever you get the labs back, you can kind of look at the values yourself. Now, in my experience with doctors, and Gretchen, you might have a perspective on this too, when I take my labs to doctors and I tell them what the optimal lab value should be, they start going into all the caveats. Well, yes, that's what your lab value should be, in a perfect world, but it doesn't necessarily mean X. And I almost feel like sometimes they want to minimize the numbers as if they're not as significant or important. So just keep in mind that the optimal lab values are almost for your information only. You're going to your doctor and just saying this is what the value should be is not going to get your doctor to do anything. You're going to need to bring a little more information, and we'll talk about that as we go through the rest of this call. But what it can do for you, what it's done for me, is whenever I look at my labs and I see, I've got these lab numbers and it doesn't match the values, it helps me to understand what I need to be researching and figuring out myself. And it's brought a lot of content that we have in the webinars and on jackcruise.com and in a bazillion other places. It brings it to life a little bit. It kind of gives you a barometer so you understand how your numbers are abnormal and what you need to be studying to figure out to start connecting dots for yourself. So anyway, just kind of a little backdrop. And Gretchen, I'd love for you to chime in here and continue your story about taking lab values to a doctor for this PCOS diagnosis.
So we took the
I'm not hearing you at all now. We'll get there sooner or later.
Is that better? Is that better?
Is that better?
Yeah, it's better. I talk a little bit.
Okay.
There's some kind of weird feedback,
So,
like the bass is high or something. I don't know if it's like if in your levels
yeah,
of trouble or whatever, but I mean, I think if you just keep the mic away from your mouth, that's probably going to be fine. Just
yeah, I'll keep it down. Um, when I took those labs that I brought into my primary care physician at the VA, um, she's like, look, you have PCOS. I need to send you to the endocrinologist. Take these labs with you. She's like, we'll go run labs too. We'll send you down to the clinic and we'll run labs as well. But I want you to take these labs with you when you go to see him. It's going to take, it was about 3 months to get in to see the endocrinologist at the VA. And, that's the challenge, is when you're in a system that is a managed care system, you may need to see a doctor as fast as possible, but the reality is you're not going to see them when you really need to be seen. And so the chance to actually get the lab work drawn at the right time, when you feel bad versus when you see the doctor and you feel okay and they draw the labs and they're like, you're normal. Well, I took all this information in, and he completely discounted the lab work that I had brought. He discounted the lab work that the VA had run. And he said, you don't have PCOS. It's wrong. You don't have a thyroid issue. You're overweight. Deal with it. You need to exercise more and eat less. And I stopped and I looked at him and I said, excuse me, I've been exercising and eating less for the past 10 years and I haven't lost any weight. Do you really think that's the right answer? He goes, well, maybe you just need to accept that you're just going to be big for the rest of your life. And I looked at him and I said, you're fired. He goes, you can't fire me. I go, no, I don't ever want you touching my labs, my case, my chart ever again. I will work with your intern to run the things that I want to have run, but I don't ever want to see you come into this office again when I come in for an appointment. I don't want to talk to you. And after that, I went down and I filed a complaint at the, they have a complaint office down in the basement at the Washington, D.C. VA. I went down and filed a complaint against him. And at that point, after filing the complaint, I walked back to my primary care physician and I said, I appreciate your work. She had just recently been hired by the VA. And I said, but I am making the decision to leave the VA after the treatment I received from the endocrinology department. I appreciate what you've done for me, but I'm firing the VA at this point. You guys aren't helping me. I'm going to go find someone who will. And if that means I have to pay out of pocket, I will. And I walked out and I haven't been back to the VA since. And that was in September of 2011.
So talk a little bit about coming across the MDA thread and what was going on and what things started shifting for you with a lot of the stuff that you were finding through the leptin reset and a lot of the things that Jack was talking about. What I'd really love is for people to start seeing how you started connecting the dots and where you started finding your breakthroughs, because I think a lot of people that have been on this journey and have been spinning their wheels a little bit need to see someone who's made it work so that they can, emulate that and they can, mirror that back and take some good takeaways for dealing with their own health situation.
Yeah, well, if we go back to the monster thread, I fought Jack tooth and nail for the first, I think, 3.5 months. I refused to get labs at that point. I refused to not work out following his leptin reset. I kind of was, I guess you could say I was kind of half-assing it. And then when I ran, I kept asking questions. Why wasn't things working? And he would point me back to earlier posts, and he goes, things aren't working because you're not following it. He goes, you can follow a leptin reset, but if you don't know what's wrong, you can't focus on the right things to help it fix you.
So where was the resistance to getting labs done coming from? Did you just feel like in the past it hadn't been very helpful? Did you just not believe that that would be the thing that would break through for you?
Part of the reason I wasn't willing at that point to work at getting the labs is with the VA, getting some of those labs run was freaking impossible. And at that point, I hadn't figured out you could go out on your own and get labs. And once I figured that out, and once I figured I could use my flexible spending account and my health savings account to buy them, and I could claim them on my taxes as a medical expense if I met the 7% deduction for the year. Once I figured that out, I was like, oh wait, I can do this and I can leverage this and I can make this worth the money out is not the money going out in the long run. When you figure out how to leverage your income taxes to use the medical expenses as a deduction, especially when you start collecting, how much you're spending on pharmaceuticals, how much you're spending on dental care, how much you're spending on lab work, how much you're spending on co-pays. Those are deductible in your taxes if you meet a certain percentage of your income. And
I think a lot of
it
people
took
will
me a while
relate.
to.
I think a lot of people will relate to your resistance to the labs. I remember whenever I first found Jack, I resisted the labs piece too because the idea of trying to figure out how to get labs done felt so daunting, and it felt expensive, like how much money am I going to have to spend to make this happen? And it was really, really overwhelming. I mean, I'm sure there's a lot of people on this call who had a similar experience with labs. We've seen it in the community too, people that for months and months and months have tried to get better and tried to do the protocols and the prescriptions and have seen some things shift, but it's just not quite there. And at the end of the day, the holy grail seems to be the labs.
Well, and I think one of the things that helped me was not seeing any results, gaining weight while on the leptin reset for those first 3 months, asking the questions and having Jack, just be like, hey, I gave you a simple format, follow it, and go get your labs run. And once I got my labs run and figured it all out, there were things I could adjust individually, as far as limiting how much TV I watched at night. There were things I could do for my circadian mismatch. Um, I've always been a night owl. I've always worked nights. I've always worked swing shift. It's only been in the past 13 years that I haven't had that lifestyle.
Mm-hmm.
And it's only really been in the past year that I've been really focusing on, hey, it's night, time to turn off the lights and, pay attention to what's going on. That really helped me.
So I remember Jack telling a story about, all the resistance and kind of making a promise to you that if you get your labs done, that you'd start finding answers quickly, and you'd be able to focus in. Talk to us a little bit about that. Like what happened? You finally got the labs, what did you learn from the labs the first time? And I think that did you pair getting labs with consults with Jack, or did you do some things on your own first?
This was all on my own. This was before Jack had started doing consults or anything else. And so, it was just ask a question on MDA or paleo hacks, and you'd get his obtuse answer. And you'd get frustrated as hell. You're like, what does that mean? I would get frustrated, and I'd continue to ask more questions. And the first set of labs, the biggest thing for me was my ASI was upside down. So it was showing, why I couldn't get up in the morning.
For those of you that don't know, that's adrenal stress index. Your adrenal stress index was upside down. Okay, sorry, go ahead.
So for me, it explained why I couldn't get up in the morning was because I was awake at, midnight, 1, 2 a.m. and I couldn't fall asleep. So by the time I fell asleep and it was time to get up, it was just a perpetuating cycle as a result of working so many years on a swing shift or a gray shift operation. I was just out of sync. So, at that point, Jack had his, Casey Anthony, OJ, Michael Jackson post, and I kind of followed that, some of the things he recommended in there, and kind of did does this supplement make sense for me? I'd ask myself and try to listen to what my body said, and if I got a yes from my body, I would take it. If I got a no, I wouldn't take it. And I also leverage my chiropractor. He had what he called a meridian test tool in his office that he would test me with those. Yeah, kind of like a kinesiology. He would test me for those things I would bring in, and he'd say yes or no.
Yeah.
And 90% of the time, the things I said yes to myself were the things that were on target with that testing tool. And so that's what I did.
What were some of the early, like, what, tell us some, I would like for you to just kind of highlight over the next few minutes some of the big breakthroughs. Like, I figured out this, I figured out this, I figured out this. What started sequentially happening for you as you got labs? And I know that you went through a process of finding a couple of doctors too to really support this process for you.
Getting the labs and getting the PCOS diagnosis was huge for me because that just linked the migraines and the PCOS together. It started to make sense. It's like, oh, and one of the things that helped me was as I continued to follow the leptin reset, suddenly I started cycling normally. Whereas, for the past, 20 years, I never had a normal cycle that I could, tell time by. Now all of a sudden, as I'm moving into my late 30s, early 40s, I'm seeing a normal cycle. I'm going, wow, this is weird. This isn't normal. Well, it wasn't normal for me. It's normal for other women, but it wasn't normal for me.
Yeah.
And so I started keeping track, kind of a journal of when do I have the migraines? When are the things showing up? Because I always thought migraines for me weren't hormonally related.
Or
I thought they
environmental.
were always were environmental, allergies, weather fronts, and completely found out that my hormones were driving all of my migraines. That was it. There was nothing else going on but hormones. So at that point, I went out and figured out, okay, what do I need to do? I went and I got more labs run in early January of 2012. Found a doctor in the local area who is a paleo advocate. Um, she she was great because when I went in to interview her, I didn't take any of my information with me. I took copies of my labs so she could have them, but I didn't want to discuss them with her. The first thing I talked about, I told her what my health goals were. What do I want to achieve by working with her? And what I wanted out of a relationship with her. And her response to me when I started asking questions is, I am your partner in your effort to find health and wellness. I can't provide you, I can't tell you how to do things. I can provide you guidance, and only you can make the determination of whether you're going to take a medication or not. She's like, whatever your health goals are, I'll support you, I'll work with you, I'll be a partner with you. I asked her if she'd be willing to do work with another doctor on bioidentical hormones. She agreed.
Now,
She's
had
like,
you already had
she's
your
like,
BHRT doc lined up at that point?
yes, I had, but I just wanted to make sure that I was
They would be
going to
different.
use one doctor to manage me versus going to two separate doctors.
Yeah.
Because sometimes you have to go to two doctors to get the stuff you want. Fortunately, my doctor was willing to work with me and willing to work with another doctor to help me manage my bioidentical hormones. And we've been at it for a year and a half now, and it's like clockwork.
Mm-hmm.
I submit an update to my bioidentical hormone doctor. He updates the plan. They unlock the plan for me. I review the plan, and I tell her whether or not there's any changes as far as the prescriptions,
So,
and if I agree with the changes or if I don't.
one of the things
She
that I want to point out along the lines of what you're saying here that I think is really important, another important takeaway for people is you've been doing something that I've just started doing, and that is tracking your symptoms day by day and tying that into your cycle so that you can take that data and apply it to normal hormone cycling in women, which I think is huge. It's not something that I don't know if I even have I think I'm dense because I heard you talk about doing that. I think my perspective was that's a lot of that's a lot of work. And I don't think I was convinced that it would really make that big of a difference. But I've already started. I have a new BHRT doc that I'm working with too, and I've already started connecting some dots. And I actually have some data by which to advocate for things that I want. So that's another really important part of this for women. And I know as we go through the boot camp, you have a lot of worksheets and different things that you're going to give people in the community that really want some more help with this, so that they can start keeping track, and then they have a way of advocating more, proactively with data, which it seems like docs just really want the data.
Well, and I would say that just journaling is helpful for men too. I mean, under stress, men have things going on that are going to impact them the same way women do. Men have hormonal cycles, they're just not the hormonal cycles we think of.
Right.
So I think that that's something valuable for men. I mean, it's one of those things, we don't talk about, but, hey, if a guy suddenly starts, having more morning erections, that's a good thing. That means he's having positive impacts, or if they're decreasing, what's going on that's causing that?
Mm-hmm.
Those are things that guys can use too. Whether or not they want to discuss that with their doctor, that's their call, but at least they have something that they can go back and refer to. Those are the things that helped me. With my doctor, what was really interesting is we pinpointed through journaling and tracking blood sugar levels at different points in the day and how I responded. We figured out that, hey, at a certain point in my cycle, my blood sugars go off the rails, and it doesn't matter what I eat. But that's the PCOS. That's, at the end of my cycle, I could be 100% keto and not have any sugar, and my blood sugars are in the 110s to 120 range. And she's like, you shouldn't be having this. Oh, my HbA1c is normal. It's 5.4 or less most of the time, but I have these crazy spikes, for a week and a half at the end of every month.
Yeah, I think when we're talking takeaways too, I think a big one that I've experienced myself, I've seen in you, so many people in the community, and I've watched with Jack, is that, the purpose of having a doctor is to give you their perspective and opinion if you respect it, to write prescriptions if you need it. But it seems that really us getting healthy and getting optimal is we're taking the bull by the horns and figuring it out. It's not, we're not, counting on the purpose of finding a doctor isn't because now a doctor's going to hack all your labs and tell you what you need to do, because that's probably not going to happen. That hasn't been my experience. I don't know what your experience has been like, Gretchen, but I have a BHRT doctor that I love, and I'm so grateful for her. She's been really, really supportive, but everything that she's done for me has been at my request. And I want to make that point for people that what we're not recommending that you find a doctor to figure all this out for you. We're recommending you find a doctor to advocate for you if you need it, and to help you get the medical care that you need.
I gotta say that, with my doctor, she's been there's certain things she has good knowledge on, and she's been very focused on helping me understand those things. She's been very focused on educating me on my thyroid and my thyroid levels. She's been very focused on my lipid panel, and it's kind of a give-take sort of relationship we have. She will go and help me educate me on those things when we have when I have appointments or meetings with her. And I kind of consider them meetings versus appointments. It's really, I'm meeting with her and we're talking about where I'm at, and what are some of the things we need to do. And then the next thing, we talk about is, hey, we may be running labs, and she's like, I really don't understand these labs. And so what I do is I go out and I find literature on those labs and I send them to you, and it's like, hey, you said you didn't really know a whole lot about how to read these labs or these sorts of things. These are some journal articles I've found that I try to help myself understand them. I don't know if they're of value to you or not, but you don't have to go do the research and go out and find it. I'll do the research for you. And she's actually been, through some of my questions, and I know there's a lot of people on the forum that have started seeing my doctor. We keep asking her questions, and she keeps asking to look at new labs. She's asking us to try different things. She's actually started exploring different types of lab works for herself, and she's using herself as a guinea pig and questioning things. And whether that's her just own curiosity or whether it's us asking the questions ourselves and she wants to be able to answer our questions, I'm not sure, but I'm benefiting from it, and I think it's a good thing.
Yeah.
Um,
So one of the things that I want to mention too, and probably a lot of people on the forums that have worked extensively with doctors will have this experience. There's what they call a standard of care, and if we had Jack on, maybe we'll bring you on, Jack, during Q&A if you're up for it. They have what they call a standard of care in medicine. I'm dealing with some things with my thyroid right now, and they saw some weird thyroid numbers where I looked hyper, but it didn't make sense because the other numbers didn't correlate that I would be hyper. In fact, a lot of time I'm hypo. And I asked him, so what if I am hyperthyroid? What are you going to do about it? Give me a rundown of what you want to do. And he gave me a list of things he was going to do. And I told him, I said, I won't do any of those things. So what if we do nothing? What does that look like? So I actually have an appointment coming up with him again in August. We're reset a couple things. We're going to do labs again. But I find that my relationship with this doctor, with my bioidentical hormone doctor, and I have a new primary care doctor, is very, very collaborative. And I feel like I have to really be on my toes. I have to be ready to go in and advocate from my perspective and really, kind of bring a different lens through which they need to view this because they do have a standard of care. This is the point I was trying to make. They do have a standard of care that in the medical community they're expected to adhere to when they're treating certain conditions with patients. And for the most part, that standard of care probably isn't going to resonate with people that are in the Jack Cruz community, that's for sure.
yeah, and it's one of those things. I when I see my doctor, she charges me for a long visit. When I get my explanation of benefits, she charges me a long visit. That costs more than the standard 15-minute visit, which doctors usually charge against. They get only paid for a certain amount. She makes no money off the time she spends with me whatsoever. And I fully expect at some point she's going to turn around and go, I'm not going to charge your insurance company, but I will charge you. And here's your cost for the year. And she's going to say, this is what it's going to cost. You can do it in installments. I fully expect her to do that in the next couple of years.
Yeah. This is one thing that you're going to go over as well, Gretchen, whenever we get into this in the boot camp is, how do doctors get paid and how it's really important as a patient, if you have insurance and you're wanting to leverage your insurance, that you understand how the whole system works and things that you can do to work within the system to advocate for yourself a little bit. So we'll be sending an email out probably within the next hour. If you watch your inbox, I'm sure everyone on this call is on our email list or you wouldn't be on the call. But we're going to be sending an email out that talks a little bit about the boot camp that we're doing. But we're going to go into a lot of this. You can definitely ask questions here. In the next few minutes, we're going to kind of wrap this up and start taking questions. You're welcome to ask questions, and we'll answer everything that is realistic for the time that we have. And we're also going to go into this deeper. We have a lot of forms and things that we're going to give you so that you can track things. And Gretchen has a great arsenal of journal articles and different things that she's used to advocate for her own issues that she's going to share with everyone too. So I think that'll be really helpful to you guys.
I think one thing that's important that when you talk about finding a doctor and figuring out how to fix yourself, it comes, for so long, I was of the thought process that the doctor is going to help me. The doctor is going to fix me. And it took me, 34 years to figure out that the doctor isn't going to fix me. I have to fix me. They are guides on my journey. And that's really what they are. They're guiding me through this maze of biology and chemistry and physics that I may not have the same aptitude that they have for certain things. But I can ask intelligent questions about my own health based upon my own experience. I know myself better than anybody else. Back in January of this year, I had my labs run and my hormone doctor refused to move my progesterone. And I was practically in tears because I was having migraines 5 days out of the week, 3 weeks out of a month. I was miserable. And, you know, I didn't have the time to take off for those migraines. I had to go to work. I had to work with those, and it was no fun. And I remember calling up to my program advisor in tears and just saying, can you help me? And they said, let's see what we can do. And next thing I know, they got me an hour-long conference call with my bioidentical hormone doctor, and he and I talked for an hour and a half. And he goes, but this level I should be giving you should work. I don't understand why it's not. And I go, it's not working because I'm not in the bell curve. I am the outlier. I'm the one that throws the curve every single time. And by the end of the discussion, he and I came to agreement. He goes, give me as much detail as you can. He's like, I don't like spreadsheets. I don't like looking at spreadsheets. I like looking at journals. Give me a day-by-day blow of how you feel. And give it to me on a weekly basis. Let me see how things are going, and then we'll work it. And he goes, I will write you a prescription that's big enough that you can adjust as you need, and when you get to a point you're comfortable and you're not having the migraines, let me know. And so now we've got this great working relationship, and I send him updates. I try to send him, you know, every week to 2 weeks. Sometimes when it's stressful at work, they only get updated once a month. And I get messages on my voicemail from him. Hey, where's your update? I get emails from him asking how are things looking. And so we get there. But it was a give and take relationship, and him learning to understand me understanding where he's coming from. He's got a lot of professional expertise, and I acknowledge that. And I said, I understand, you're the doctor. I said, but you don't know me, and you don't know my biology. It doesn't function like everybody else. And he goes, well, what do you mean? And I go, give me Tylenol with codeine, and what do you think would happen? He's like, you'll get calmed down, you'll kind of move into a relaxed state. I go, I get hyper and I can't stop moving. He goes, okay, that's not normal. I go, no, it's not normal. I don't react the way everybody else does.
So this year you've kind of strung through a few different tweaks to your own protocol and how you're handling things that have resulted in some pretty significant breakthroughs. Tell us a little bit about those.
The biggest thing for me was figuring out what the right progesterone doses were. It was also getting my thyroid hormone tweaked. You know, that was one thing that when I first started running labs and posting my labs on the NDA thread, and Jack would comment and he'd say, looks like you've got some thyroid issues you need to address. Okay, well I don't know what that means. Obtuse? You know, at this point I didn't know how to look at labs and didn't know how to interpret them, and I started, you know, going out to websites and trying to figure out how to read my own labs. You know, I didn't really start understanding what I was looking at until, you know, probably last summer. And my current doctor sat me down and explained everything. And I understand it. And I can remember when we first moved me to Armour Thyroid, and I said, you know, this doesn't feel like the right dosage. And she's like, well, let's start out slow and we'll get there. And I can remember in the fall, I'm like, this isn't the right dosage. She goes, well, what's the right dosage? And I said, well, I think I should be on, you know, 1.5 grains of Armour in the morning and 30 grains of Armour in the afternoon. She goes, why do you think that? And I go, that's what my body's telling me I need. And she was like, well, how do you know that? And I'm like, I don't know how I know it. It just, that's what those are the numbers my body is telling me. And, you know, those were the things that once we got me to the right thyroid dose, all of a sudden my sleep got awesome. And that also coincided with, you know, spending money and getting the Magnetico sleep pads. So, combination of the thyroid, the combination of the magnetic go sleep pads, and the combination of finally getting to the progesterone to a level that I could function at on a weekly and a monthly basis. My hormone doc kept telling me I want you to cycle, and I flat out told him, I'm not cycling my hormones, my progesterone. I don't feel good when I cycle. And I said, if you want me to cycle, you're going to have to give me a whole lot more than what you're giving me. And he's like, but that's too much. And I go, well, then we're going to roll with how I'm doing it until you come to an agreement that I need more. It also helped that I had figured out how the insurance companies play their games. It was one of the biggest challenges for me this year was getting my son's speech therapy covered. And it took me from January of this year until the end of March to get them to cover the speech therapy for him as a medical necessity for last year. I was elated that we finally got that covered. Granted, with the insurance plan we had, we still had a 40% copay. So I didn't get all the money.
The nice thing about
that we
insurance,
paid.
if they'll agree to cover it, is usually it reduces what you're being charged in the first place. So 40% of, a lesser amount of money is still really helpful versus
Yes.
the insurance isn't going to cover it. So now you've got whatever the retail rate is for that service and you're paying 100% of that.
And the interesting thing is while I still got his therapy covered for last year, I'm back fighting the insurance company again for the treatments he's received for the first half of the year. Mm-hmm. And I think that's the thing that frustrates people when you're working with the insurance companies. At least it frustrates me. So I got his labs. I got his not his labs. I got his therapy covered last fall. For 2012. I'm on the same plan as I was last fall. Shouldn't it be covered this year too? How hard is that? But no, I got to go back and I got to do the same thing I did in January through the end of March to get his speech covered for this year.
I give you a lot of kudos, though, Gretchen, because the way that you're able to advocate and navigate and get all this stuff done, I'm in awe because it certainly hasn't been my experience. I personally feel kind of overwhelmed at the idea of, trying to figure out how to get insurance to pay for things. And there's things on my plan. I was just pulled up. I have a Blue Cross Blue Shield plan that it has a high deductible, but then they pay 100%. And I was noticing this section in my plan where it's like there's all these benefits that I get, and I'm looking at it going, do I get all these benefits after my deductible or before my deductible? My women's wellness exam was on this list, physicals on this list, and then all these other things. And just the idea of calling my insurance company to figure that out, I think it's intimidating. So you've done a great job with all of it, and I'm really excited. I mean, I feel like I'm going to learn so much going through this boot camp with you about how to deal with this thing. It's going to demystify a lot of this process because it's intimidating and overwhelming. And I have friends who've fought with insurance companies with no success on getting things covered, and it sucks.
Well, and that's the challenge is figuring out, when you're looking at your insurance stuff, it's asking for verification of coverage before getting the treatment if it's not an emergency.
Right.
If it's something like a therapy or you're choosing to do labs on your own, going out and asking for verification if those labs are covered and what do you need to get them covered is crucial. I mean, when I first asked, what do I need to do to get these labs covered? And they said, all you need is your ICD codes. Well, how do I get my ICD codes? Oh, you just send a letter of request and we'll give them to you. Really? They're like, they're your codes. You have every right to them. And most people wouldn't know that those codes are yours. You wouldn't know that you can go out and get them.
Yeah.
For me, that was huge.
Yeah.
It was huge.
I want you guys, we're going to take some time. If you have questions for Gretchen that mirror maybe some of your own challenges and you want to run some things by her, I want to spend maybe the next 15 or 20 minutes answering questions, or if we have less questions than that, that's fine. We can cut it off short. And Jack, do you want to do questions? If people have questions for you, will you take questions after Gretchen? Do you have time? We're like flying by the seat of our pants right now. And Jack just went silent.
Yes.
Let us know. Just let me know in the chat, Jack, if you want to do questions, and I'd be happy to facilitate that and bring you on screen. Okay. I'm going to start with a question from Mitch. So hard to get an MD
Okay.
to understand physiology as we've learned it from Jack. Any advice on how to find an MD that is open to learning about Dr. Cruz's thoughts and treating as Dr. Cruz might? I've looked at the usual paleo and anti-aging sites.
It comes down to what is my personal experience is what is the relationship you're having with your doctor? And I think that's really important that first appointment, it's an interview for you, and it's an interview for them to find out, are you compatible to work with each other? I found my doctor through, I think, Paleo Physicians Network. But before I went there, I went onto my insurance company's website and looked up her rating. She was actually got a 4-star rating, and the rating was related to how she's managing a bunch of cardiovascular patients that had cardiovascular events for a local hospital that the cardiology department were sending to her because she was having such great success. And, they're like, what are you doing? She's like, I'm taking them off statins and I'm having them cut all grains from their diet. I'm having them eat fat. And they're like, really? That works? Okay. Sounds good to us. Whatever you're doing, keep at it. It's making our lives easier. They're not coming back for a second surgery or anything. So that first conversation, I had appointments with 3 different doctors over, I think, a week and a half. I interviewed one doctor, and he goes, well, the fact that you want to use your insurance means I can't help you the way you really need to be helped. So I will be glad to help you using your insurance, but you're not going to get well. That was one functional medicine doc's response to me. And, I appreciated his candor.
I've actually heard that from a lot of doctors, and I think they experience the same frustration that we experience, and that is you need a freaking bachelor's degree or master's degree to navigate insurance and how to get them to pay for stuff. And it's a lot for a doctor to not only be treating you, but also try to advocate for you to insurance companies. Really is a lot. I think that's why it's going to be really great for us to do the call where we kind of walk through, how to advocate and what that process looks like, because you can't count on your doc to do it.
Yeah, and I see Nancy asked a question is, did I pay for my interview with my doctor? And yeah, she charged it like a regular medical visit, first time visit. And she gave me an hour and a half time for that first time visit. I could go back and look at my explanation of benefits, but it was she probably, what she charged and what insurance paid out were 2 different things, because she's getting charged on what Medicare determines is the appropriate cost for that visit and what was discussed in the code she put in. And the other 2 docs were completely out of pocket, because they didn't. One took my insurance, but he wouldn't take my insurance for the interview. That was $240. And then the other one was, I think, $300. But I was willing to spend the money because I was so frustrated with what I was getting at the VA. And when you get to the point that you're not getting help from the medical system you're enrolled in, whether it's the VA, whether it's TRICARE, whether it's Kaiser, or whether it's just your standard HMO or PPO program, when you're not getting the help you want, you're willing to go, I'll spend the money, because I'm already spending the money on the medications that I don't want to be taking. I want someone who's going to work with me to look at this. It's just one of those things. I think it's, when you look at, sometimes it's worth paying the money up front because, hey, it's a doctor. You can charge that back to your health savings account or your flexible spending account. You can count that towards to a tax deduction on the medical deductible, on your personal income taxes. If you've got a slick accountant who knows what they're doing, as far as the tax code, they'll identify that and they'll be like, save every single thing you spend on anything medical related, to include over-the-counter medicines.
Mm-hmm.
They'll give you that information.
Go ahead.
As far as getting them to understand, I think it's one of those things where it's a give and take. I know my doctor does read Dr. Cruz's blog. She doesn't really tell me what her medical opinion is. And that's, she's going to withhold that because she's got her own thoughts on how she wants to practice medicine. But I found that, she's applying certain things. With my last set of labs,
which is what's most important.
Right. With my last set of labs we had done, my highly sensitive CRP was still high. And she's like, okay, let's look back at what your lab was. Your labs were back in December. And she's like, what's the difference? And I was like, the difference was CT. I said, I'm not CTing on a regular basis right now. She goes, get your butt in the tub with some ice.
Yeah. So I want to just chime in here. We're going to actually have some websites and stuff in the materials that we give out during the boot camp. And I would tell you what the websites were right now if I actually remembered, but I don't. But I just want to mention that the kind of doctors that we've had pretty decent luck with are functional medicine doctors. Is it naturopathic doctors, naturopathic MD, integrated medicine? It's another great buzzword. To find a doctor, integrated medicine, they're typically MDs, and it's kind of like East meets West kind of thing. They tend to be out of the box thinkers. So those doctors are great. An anti-aging doc is a great doctor too. If you Google, you could sometimes find places. There's actually a website, and I wish you and I looked it up the other day, Gretchen. I don't remember the name of it. There's a website that I've used that I always have to go digging for to find not only doctors for me, but for friends. And I've put in there the kind of doctor I'm looking for, and I also checked the insurance that I've had or that a friend has had to find the right kind of doctor that actually takes the insurance. And we've had some great success that way. So if I can think of it before the end, I'd be happy to share it. But I know it's part of the boot camp that we're sending out too. So that's some tips on, how to start honing in on the right kind of doctor. Just because I went to a functional medicine doctor earlier this year. No, I think she's functional medicine. Anyway, highly recommended. And she was kind of a bust for me. She'd really worked for other people, but I had to move on to somebody else. So it's not guaranteed, but you're at least getting in the area code, Okay.
And I would say is if you have a doctor that's willing to run labs for you, stick with them. Ask them if they're willing to learn with you, because if they're willing to run the labs for you, they're willing to learn with you. Not all doctors are the endocrinologists I experienced at the VA. There are a lot of ladies and gentlemen out there, whether they're doctors, they're certified nurse practitioners, they're physician assistants, they want to help people get well.
Mm-hmm.
The system doesn't necessarily allow them to help in the way they want to, but if you've got a proactive patient who's willing to step outside the box, that doctor that you're working with who's willing to run those labs is going to go, okay, well, this person is a total pain in the butt. They're a breath of fresh air.
Yeah.
I mean, I run my labs quarterly now, and right before I get ready to send my labs, I send my doctor an email, and I said, here are the labs. I give her all the codes that need to be plugged in, and she sends it to her medical assistant, and they have everything typed up for the day I come in. They don't have to handwrite anything out. They love it because they don't have to do the work.
Yeah. And one of the things that I want to mention that I think that you've done a really great job with, that I've been inspired by Gretchen and I'm starting to do more of myself, is, going into a doc and just and saying, you know, I don't know what's wrong, kind of implies to them that you want them to figure it out and fix it. But going into a doc saying, these are my goals, this is what I want us to co-create together, is a very different kind of relationship. And you've done a really great job, I think, you know, kind of showing up for these different doctors that you work with and kind of framing the context of the relationship on the outset as this is what I want to co-create and I'm looking for partners. You know, are you up for that? You know, I think it's a whole different way of engaging a relationship that has worked really well for you. And, you know, I think that's a perspective that a lot of people could benefit from as well. All right, I
Yeah.
want to skip to the next question here. Did you have something you wanted to add, Gretchen?
I wanted to answer the next question up on the screen,
Yeah,
because I think that's important.
this is from Love My Zoe. My insurance is currently paying for all my blood tests. However, they denied my claim for a 24-hour urine test that my doctor ordered to check my hormones, which she has been treating me for. Now I have an $1,800 lab bill. Help. I appealed and they denied it, said it was experimental. What do I do to get them to pay? Great question.
Go back to your doctor and ask your doctor to write a letter for medical necessity. And it's got to be a detailed description of why this specific lab work has to be done. That letter of medical necessity is going to be key. And it's going to help you get things paid. And sometimes it can be an actual, you know, 2-page document. It'll take your doctor's time, and your doctor may actually charge you a visit to write that up, because it's going to take your doctor time. But as long as you're okay with them charging you a visit and you pay a copay for that, that's going to be worth it. I will say that one of the forum members, Fitness at Home, figured out how to get her Genova Diagnostics 24-hour urine test paid for. There's a way you can get it paid for if you pay an upfront fee. But however, there are certain insurance companies that are not eligible for that, so you may end up paying more out of pocket. I'm going to try to put together information that she sent me, step-by-step to give you all. So that way, in the future, you won't end up with that $1,800 lab bill. But
Gretchen,
I would definitely say,
your papers are rubbing over a microphone or something. Maybe this is
okay, sorry.
I don't know what's on your computer. If there's like a little spot, but just a heads up there because it's pretty loud when you.
Okay. So I'm going to try to put something together to explain that, what Fitness at Home found. And I actually called Geneva today and asked them about it's called an Easy Pay plan or Prepay Advantage, and then they've got a Prepay Advantage plan. The Easy Pay plan, you check a box and then you pay with cash, check, credit card, probably credit card or check is preferred, the amount for the lab up front. And it can range between, $89 on up to, I think, $250, depending on which lab you're having run. And what they do is they then go back to the insurance afterwards. The insurance will pay out what the insurance pays out, and then what will happen is Geneva sends out 2 letters of information or billing statements, but you aren't responsible for those billing statements, and they don't go against your credit rating because you selected the Easy Pay. But there are certain insurance providers that are not eligible, and their website lists those out. But then they have, for those specific insurance companies, they have what they call a Prepay Advantage. It's a higher amount that you pay in advance. And they attempt to get the insurance company to pay for it, but it doesn't always work out, and you still may end up paying the full amount. That's where that letter of necessity comes in. If it's a detailed explanation as to why your medical provider wants to run this test, and that justification, one of the things you can do to help your doctor build that letter of medical necessity is go out and find journal articles that indicate why using a 24-hour urine sample is acceptable or is a new method of making tests. Those are great things.
I think it would be
And
great,
then-
Gretchen, for you to actually, for this boot camp that we're doing, and you may have already put this in the plan, I think it'd be great for you to actually have a list of places where you go to find these journal articles. So that,
Yeah.
if we don't have the journal articles in our repository that we're sharing with people, they can go themselves to find them. I think that would be huge.
I will try to pull some of that stuff together for everybody.
That'd be great.
And then one thing, Genova is also expanding their list of insurance providers that consider them an in-network lab. And Blue Cross Blue Shield is one of the bigger insurance companies that has considered Genova Diagnostics an in-house labs, unless you are with the federal government, Blue Cross Blue Shield.
Right.
And don't live in the DC metro area. But then you still have other options.
All right. Mia asks, have you ever been diagnosed with Lyme or heavy metal poisoning?
I have not. I've never had any indication of Lyme's disease
All right.
or heavy metal screening.
All right. Kay asks what insurance you use.
I use the bottom of the barrel, United Healthcare.
They're the bottom of the barrel.
They are the largest insurance company in the United States. They are not, they don't have the most advantageous plans. I've actually had my doctor tell me, she goes, you would be better off going out on one of the exchanges coming out, considering the insurance you've got. I have a high deductible, it's called a consumer-directed healthcare plan. It's a high deductible plan. My in-network deductible is $6,000. My out-of-network deductible is $10,000, and those are the minimums. Once I meet those minimums, I have a 40% co-insurance. Our prescriptions are not covered at all. So
You have sucky
yeah, let me just tell you, it's one thing when you have, and here's one of the things that I really hit home for me is United Healthcare has what they call 3 tiers of drugs. Tier 1, they cover 100%. Tier 2, they cover like 40%. And Tier 3, they don't cover at all. Well, asthma medications are in Tier 3. Diabetes and PCOS medications are in Tier 3. So the metformin and the cyclocet I've been taking to help control my blood sugar is, the cyclocet was $400 a month, out of pocket, still is. My asthma medications, which is, I'm just taking as a preventative right now to help with my seasonal allergies, so I don't end up in the hospital, that is about $150 a month. And my son got diagnosed with asthma as well, and we were spending about $250 a month on his asthma medications. These are medications used to help manage diseases, yet they're not covered by insurance.
Wow.
But I knew this going in when we selected this plan. Here's the great thing. All that money that we're spending is going to go on our tax return as a deductible amount. This year for 2012, we had to meet at least 7% of our income had to have gone toward medical expenses. We easily met that. For 2013, at least 10% of our income has to go toward medical expenses. We will meet that. And the great thing is the deductibles count, co-pays count, co-insurance counts, any money you pay toward labs counts, all the prescriptions count. The one nice thing about my deductible is prescriptions count toward the deductible, so that's nice. But what you're going to see is when the health exchanges start coming out in the next couple of years, you're going to see plans change. You're going to see people be pushed toward these high deductible plans, and it's going to be challenging for people to figure out how to afford it. But there are ways that if your companies will help you with those high deductible plans by having health savings accounts, and most companies do contribute a portion of money towards your health savings account.
Overhead ones. Oh.
So as you guys can see, I brought Jack in. He's in a dark room. There's the light.
That's kind of, turn it down a little bit.
I feel like I've brought in the Godfather. Wow, I said that out loud. So Jack, you have a comment over here in the queue that I thought would be kind of a great little spin-off here for what we're talking about. And you said the best way to stimulate, I know me, I can't believe I said that. The best way to stimulate a doc, make sure you know something they don't and bring data. What do you, share a little bit, give some context for everybody, what you mean by that.
Can you hear me?
I can hear you.
Can you hear me? All right. I guess the reason I said that this week when I was down in Destin, I had a guy contact me on my doctor or Jack Cruz Facebook page, and I didn't realize he was a doc that trained at LSU, probably 3 or 4 years after me, and he's now a neurologist at UAB. And he said to me, he goes, "Look," he goes, "I'm an academic physician in a position to do lots of different things." And he goes, "And I have to tell you, I've been reading some of the stuff you've been posting on Facebook." And he goes, "I thought in the beginning it was a bunch of horse shit. And the more I read it, the more I started to realize that you might have some answers to things that I am completely perplexed to." And that's when I said to him, I said, "Well, that's the reason why you sent me a private email and you wanted to talk to me." I mean, he was very adamant about talking to me. And I told him, "Well, I'll be on vacation this week. If you want, you can contact me by Skype." And I happened to be up at 6 o'clock in the morning watching the sunrise. And I saw that he was online, and I contacted him, and we talked for 2 hours. And that's exactly what I said to him. I said, "The reason you contacted me is because you realized that I knew something you didn't know, and it made you curious." And what most people, I shouldn't say people, because people's the wrong word, patients. Patients don't understand about doctors. You guys all love bashing us, but you really, Mia said it earlier tonight. Patients don't understand that we didn't learn a lot of this stuff. And you all assume that we know way more than what we do know. 8 years ago, I was a dumbass just like the docs that you're going to see. And the only reason it fixed me, and I tell everybody, so I'm honest about it, I fixed me. It wasn't that it was someone else that motivated me to change. It was I couldn't figure out what was wrong with me. And that's when I figured it out. And what kept me going was I became more curious, more curious. I said, there's a lot of open doors here that I'm not aware of, that I need to become aware of. And the only way for me to become aware of it is to keep asking better questions. See, here's another thing patients have a problem with. They really do. They want answers, and you want to know the truth. You don't want answers. You want somebody, just like I said, I made a joke earlier when you and Gretchen were talking about what is really a doctor. Patients are weeds and doctors are houses that you grow up against. You want to be able to ask us questions and grow together. I think that's one of the things, at least in my opinion, with Gretchen and her doctor, that she's cultivated a relationship with her doctor where it's really the new kind of doctor-patient relationship where she can actually go to her doctor, ask questions, and the doctor is not feeling bad about not knowing the answer, and you form together. I've seen so many people on Facebook when I post different things, pound docs. I'm like, look, you're never going to get doctors to change if you're pounding them into a pulp. What you need to realize is they are unaware of what they don't know. And if you are part of their solution, you will eventually create the doctor that you want. And yes, will it take time? Actually had several people, very prominent people in the paleo community, say, well, I'm not paying a doctor to educate them to treat me. And I said, well, here's the problem you don't know. You may be a very prominent paleo person, but you don't know shit from Shinola when it comes to clinical medicine. And they do. And see, you need to know what they know, and they need to know what you know. And I look at this just like going on a date with a woman. If y'all don't hit it off, are you really going to be successful in this relationship? And you know what? Patients and doctors don't look at the doctor-patient relationship that way. And in my opinion, that's the single number one big thing that's missing. I mean, if I could change anything about my physical practice where I'm at, is that I wish I could spend a minimum of an hour to an hour and a half with every new patient and just talk to them and ask them questions. Because I'm telling you, I'm a far better doctor when I know as much as I possibly can about the patient, and not when I know very little. And it frustrates me even on the forums when people come on and they post all this bullshit about their labs. I'm like, give me some context. Give me some context of you. And and I have to give Gretchen credit. I have to give Carolyn credit on the forum, because when somebody new comes on, they immediately try to tell them to go into the optimal post place and start a journal. Let me tell you something. I am much more likely to help somebody who starts a journal, and I'm going to wait several pages before I say anything. But I promise you, when I say something, it's going to be very directed. It's going to be very, very important for that person to hear. They may not realize it, but eventually they will. I mean, anybody who's followed my blog long enough, um, anybody who's followed the blog long enough knows that sometimes I'll post a blog and then 2 or 3 months later, you'll start to realize the significance of it. If you don't believe me, look at the current blog post that I just posted a couple of days ago, and there's a guy in the comments, Andre, and I just said to him, by one comment he made, I said, Andre, go back and read EMF 1 and 2, and I don't know, I forget whichever one. And it was like you could see he had his epiphany right there in the comments of the blog. And I just smiled and I said, that's what this is about. This is about lighting people on fire. I said this at Paleo Effects, 2 years ago, and I'm saying it to you guys now. We do not diminish ourselves when we share our candlelight with someone else. And if you want to know what the blog's all about, the blog is not about anything else except making you curious about why it is we're in the situation we are, why some of the things may be happening. I'll be the first one to tell you, I don't have all the answers, but I will tell you this: I dig a lot deeper than most other people will dig, because I'm not satisfied with what I've been taught, what I used to believe, what I believe now. And I will tell you this right now, and I said this to the doctor from UAB. He asked me, he says, Jack, can you tell me how much of your knowledge is out there on the blog right now? And I told him maybe 5%. I said, there's plenty more to go, plenty more. But you know what I'm overwhelmed with? It's how much I don't know. And you as the patient have to be okay with a doctor who can sit down in front of you and tell you, you know what, I don't know. And I hate to say it, but I don't think a lot of patients like that. That's
So
the
one of the
truth.
things that I want to point out based on what you're saying, Jack, and kind of give props to Gretchen for this, is that they're building that relationship with the doctor really does take time. And I think a lot of us come to the blog in the community feeling the weight of our own health issues and wanting resolution and wanting it to be fixed right now. I mean, I certainly have been very intense for the last 2 years. Anytime I come up against a challenge or something new that I want to be different, I want it fixed now. It's really frustrating to go to a doctor and have a lot of resistance, and they're not budging, and finding another doctor and building that relationship. But one of the things that Gretchen has done well and that she's going to teach us how to do in this boot camp is to build a great relationship with the doctor where you understand a little bit more, like you're saying, of the various conditions that exist within that ecosystem, and really get some good distinctions on what's going to help you to be able to get some traction and get some results. So Gretchen, again, I really appreciate you taking the time to share a lot of this information with us and help us to understand it better, because it's going to make us better patients. But more importantly, we may not get fixed tomorrow and we may not get fixed on our first visit, but over time, we'll set a trajectory that'll, for the long term, help us to really optimize our health in the way that Jack is teaching all of us to do here on the blog. So I want to address this question from John. If you guys have questions for Jack, maybe I can get him to stick around for 15 or 20 more minutes and answer questions if you want to put them up there in the queue. John says, I'm 46, 100 pounds overweight, and have testosterone under 100. Does Dr. Jack ever recommend testosterone injections to help balance hormones? I convert to estrogen. And you might clarify too, Jack, the BHRT thing, like synthetic testosterone or BHRT.
Well, let me start by saying I can't answer this question because we're on the internet and I can't practice medicine on the internet. But hypothetically speaking, if someone had this kind of problem, the first thing that I would want to know is what the context of the rest of their labs are. When I hear a guy who's 46, or let's say in his late 40s, has a testosterone of a 95-year-old man, that tells me completely that the patient is under acute stress response. There's deep-seated issues, not only in the pituitary, the thyroid, and the adrenal gland, but the end organ, meaning the testicles, are not making testosterone. What does that mean to Dr. Cruz? Let me give you an insight to what I think about when I think about labs. What you guys think about labs, what I think about labs are totally different. This is a person with no energy. This is a person with no electrons. This is a person with no photons. This is a person that has broken mitochondria. So the first thing I need to do is teach them how to support their mitochondrial health. B, I need to teach them things of how to get more energy in the system. See, all life is energy. All disease is a lack of energy. Now, there's different pathways to that lack of energy. For example, when Gretchen did her guest blog post about PCOS, she had her own little epiphany because I'm pretty famous for not giving everybody the goods yet. Why? If I give you all the goods, I'm going to overwhelm you with data. I mean, my blogs already hurt people's heads constantly. But trust me, there is a grand scheme here. I think there's enough on the blog now where if you're paying attention and you're not completely overwhelmed by the science, you're going to start to realize there is a common thread to this whole thing. And I would tell people, go back and reread some old blogs. Go back and reread the quilt. Look at how the quilt is numbered from 1 through 30. Right now we're sitting in the I think the 29th or 30th position, but yet this position has actually floored people, in terms of the things I'm bringing to the table. I haven't even gotten to the real goods yet, but this is what I would tell you, John. You got big time issues, and the answer is, would testosterone injections help you? The answer is it depends on the other parts of your labs, like what's your sex hormone binding globulin, your total estrogens, your DHEA, your pregnenolone, your free T3. There's a lot more to it. But cutting to the chase, the answer is if you didn't want to have any more children, testosterone would help you freaking humongous. But remember, testosterone for a man who's 46 years old acts just like birth control pills do for Gretchen or for Misty. And testosterone for you, is there differences in the type of testosterone that maybe your hypothetical doctor would recommend versus other testosterones? The answer is yes. And the reason why is something that you posted in your thing. You said you convert estrogen. So that means you need an aromatase inhibitor, and you also need to have your diet retooled to be loaded with a lot of natural aromatase inhibitors like green tea, coconut oil, resveratrol, turmeric, ginger, all the things I talked about in the Epcot webinar. I didn't do a blog post on the Epcot webinar, but I was thinking about it today when I did the July webinar that I need to post something about that down the pike, because these are the kind of things that will help you realize that this is an important thing for me to say. Really important. Maybe not now, but it will be in the next couple months. There is no one thing on the blog, on the forums, or on any labs that's primordial importance. What I want everybody to understand is everything is interconnected. Every single lab means something to another lab. When one goes up, one goes down. How I want you all to think about it from this point forward is, if you're old enough like I am to remember what an equalizer used to look like, when you turn one knob up, it affects all the other knobs. In other words, your brain is designed to think with one variable. You have to teach your brain as a patient to realize that when you do one thing, it affects all 19,000 other knobs on your DNA and on your genome. And that's what confuses people many times, I think, on the forum. When I mention something, they'll say, wait a minute, you told Gretchen this, you told Kathy Lou this, and you told Mitch this. You're right, I did, because everybody's knobs move differently because of where they find themselves. Now, what's the real reason for that? Here's the hammer point for the July 2013 webinar. And I've already told Gretchen this, and I think she'll probably smile and appreciate this. I remember when I told her, I was in my hot tub in Nashville with her and her husband on the phone when we were doing a Skype consult. People are going to realize eventually that I am so right about biology. It has nothing to do with what's going on in your cells. It has everything to do with the field around your cells. Go back and read the first levy in the quilt and read what it says. Begin to understand that the environment that you live in is the single most important determinant factor in your health issues. And John, when I see a guy 46 years old with a testosterone of 100, what I'm going to speak about in the July 2013 webinar is exactly what you need to hear. It's exactly what you need to know. It's what is behind EMF 2, EMF 5, EMF 7, and quantum biology 1. And I know not everybody's up to speed on all the science, but guess what? My goal eventually is to get you where I am now, to understand all this stuff. My goal is to make people what I like to call them starfish. I mean, I consider Gretchen a starfish because when we first started out, she was on Mark's Daily Apple, and so was I, and she wasn't buying nothing I was saying. She wasn't. And the
He
thing
wasn't
is,
picking
through a
up what you were putting
process of
down.
adaptation, evolution, and growing together, and this is kind of what, we're talking about. Well, it's kind of what Gretchen is trying to get through with her doc at home. I kind of look at her and I smile because I give her all the credit in the world, because she was able to fight her own inner demons to say, what if this crazy bastard on the internet is right? What if I'm wrong? And she did lab tests, and the more lab tests she did, the smarter she got. In other words, she learned from her mistakes, and she kept testing. And the thing is, we can't be afraid of mistakes we made. I make mistakes, Misty makes mistakes, Gretchen's made mistakes. We all make mistakes. But the key thing is, if we can build a community and we learn from each other's mistakes. Gretchen posted something today that I thought was absolutely brilliant on the forum. She said, I'm beginning to realize that randomized controlled trials mean nothing to me because I am already an outlier. Do you know why Gretchen, and I'm glad we're talking about this tonight, because I wanted to tell you this, Gretchen, on the forum, and I'm going to tell you straight to your face. When you said it, you made me proud because it makes me realize that you realize the reason you're an outlier is because of the field that you live in. The field that you live in makes you not subject to any randomized controlled clinical trial. It makes you subject to your n equals 1, just like you posted. And let me tell you something, that is a very, very difficult thing for people to understand. Because, and I listen, I've gotten on Misty's case. I mean, I've gotten cross with her and loud and nasty. She knows it. And I've told her many times, Misty, you just don't understand that your field is what's causing your problem. And that's a very, very difficult pill for people to swallow. And what people don't understand is when you live in New York City on the 17th floor, when you live in Washington, D.C., when you live in Nashville, Tennessee, when you live in San Francisco, you have a different biology. And I'm not kidding you. That is the crux of what I'm trying to teach you guys. And when I tell you, no one has ever figured out why evolution actually exists and why it works, why the conditions of existence and why natural selection work. I'm going to give you a little hint into my head. What I think, epigenetics is directly tied to the electromagnetic field that life finds itself in. And I'll take it a step further. When you think about extraterrestrials, do I believe they exist? Yes, I do. Why? I believe DNA is the common thread in all life across the universe. But I believe when you put the DNA in an environment that has an altered electromagnetic field, the life forms take on a different form. And that's what species are. And how does it work? I'm going to give you a preview of probably the next 18 months worth of blogs when I say this to you, and I'm not going to get into it. It's all based on quantum mechanics. It's based on the resonant frequencies of how DNA acts within the environment it finds. DNA is completely subject to the electromagnetic field that it finds itself in. That's how life exists. That's why I'm convinced that there's aliens on other planets, but I'm convinced that the way their biology works is completely dictated by the electromagnetic field that they find themselves in. And is there a common tie to us and those aliens? Yes, because guess what? Einstein's theory says, through the theory of non-locality, that all DNA eventually came from one place. And people always ask me, Jack, you're always talking about evolution. You're always talking about science. Do you believe in God? Of course I believe in God, because here's the crazy thing. I think most organized religions have it completely wrong. But when you really break it down, someone had to put this shit here to make sense of it in the beginning. And the thing is, everything is tied together. There's nothing that's not. I believe every bit of DNA that is on this planet is tied to every bit of DNA that's on every other planet that's out there that we don't know about. And I honestly believe that some of the things that I scared the shit out of Misty and Gretchen and probably many of you in EMF 7 when I told you that I believe we're in our 6th extinction event, I believe the answer is already on this planet. Do I believe that all life is going to end on this planet? Do I believe that we're going to wind up on Mars and that's the best outcard? No, I don't. And did I tell the doctor this weekend from UAB kind of how I think it's going to end? Yeah, I did. And I don't think life on this planet's going away. I don't. But the problem is how I think it's going to happen. You're not ready to hear yet, because you know what? We're about 5 levels away from you being able to understand it. And the key thing is when we get there, you'll understand where we're going. Because This isn't Jack Cruz's opinion. It's not anybody else's opinion. It's founded in the laws of nature. And this is what I will tell you. Apply the laws of nature to your health, and I promise you, you will do well. It's as simple as that. I believe
Got a
eventually
question
that
here.
my profession will begin to apply these laws because they have no choice.
Got a question up here from Nancy. Are you familiar with PEMF, pulsed electromagnetic frequency therapy? It seems like the combo of magnetic and pulse frequencies supports good replacement of electrons.
Yes, it does. And if you know anything about Robert O. Becker's work, and you will probably after this next webinar, in EMF, what is it, 2, 5, and 7, I mentioned his work, but I never went into details. I'm going into some exquisite details of his work, things that you don't know about, the reasons that he was nominated for 2 Nobel Prizes. He is the reason that pulsed electromagnetic frequency therapy even exists. And yes, does it work? Abso-freaking-lutely, it works. But when you use pulsed electromagnetic frequency therapy, do you need to understand what you're doing when you do it? Yes. Does modern medicine, does modern chiropractic, does modern freaking anything understand how to use it? No. What's the reason? Because they don't understand quantum electrodynamic theory. Once you understand that, then you will understand how it works. And just so you know, modern bone growth stimulators actually use pulsed electromagnetic therapy. If you listen to the podcast I did with Ben Greenfield, we talked about a specific type of pulsed electromagnetic therapy that works in people who are extreme athletes in terms of recovery. Can I tell you that I open people's heads up and use a specific type of pulsed electromagnetic frequency to help them overcome their brain tumors so they can go home in a day or two versus staying in the hospital 7 to 10 days? Yes, doctors are already using this. But the problem is people don't understand why we're using it or how we're using it. In fact, I would say most of the people who use it don't really understand it.
All right, Robert asks, can you share the topic for this month's webinar?
Yeah, I probably could. Since I recorded it today,
Yeah, we're getting it queued up for y'all.
I changed it 3 times. I was gonna do, yeah, I was gonna do several different things, but I have to tell you, when I came home from Destin, the discussion that I had with the neurologist from UAB made me realize I had to scrap what I was gonna do, and I decided to tie a couple of knots together for people. Um, there's a lot that I threw out on the blackboard for EMF and in the quantum biology series. Let's just say that I go into some detail, very similar to the Moscow Embassy experiment that I shared with you guys in EMF 5. Let's say that I take it a couple of levels deeper in this webinar. Make you understand why I advocate for certain things that I advocate for, why I'm a huge proponent of bioidentical hormones, why I believe in the magnetical sleep mattress, why I believe that the number one risk to your family and to your own health is coming from the electric power grid and maybe not from the Wi-Fi that we're talking about right now. I'll take it even further. This will probably shit Misty pants. Many of the things that we talked about in our EMF boot camp, I'm going to tell you it doesn't go far enough. And the reason it doesn't go far enough, because Michael doesn't really understand what Becker really found. What Becker really found was absolutely profound. The experience, here's another one for Gretchen. If I was to tell Gretchen as a former U.S. Air Force Academy graduate, that some of the foundational studies that Becker did were in her own institution in 1982 and 83 and 84 and buried in documents that are published that she could probably go read, I think she's going to be floored. I think people will be floored by this information. And the reason they weren't floored when it came out, cell phones, iPads, and laptops were not popular in 1982, 83, and 84. When you learn about the PSC in New York State when I was growing up, when I tell you about what was published in the New York Times, for you to go Google during the webinar. The webinar, I will tell you, is an hour and 40 minutes. And I'm not kidding you, I ended it early. There's so much more that I could get into, but I felt I was overwhelming you with information and data. And that's what I need to do. I need you to understand that we don't need any further study. The data is already there. The problem is no one is going back and applying what we've already studied and what's going on in modern life. When I explained to you exactly that metabolic syndrome was explained by Becker 40 years ago, 50 years ago, you're going to start to look at all these posts by Chris Krasser and Rob Wolf explaining to you that you need to eat more grass-fed beef and this and that is total bullshit. It has nothing to do with your diet. I mean, Gretchen knows I took a lot of heat on the forum probably 2 or 3 months ago because I said the diet is not that important. What did I tell you tonight is important? The field that you live in. And the
When
field
you
that
say
you
the
all
diet
live
isn't
in,
that
the
important,
field that
Jack,
I live in,
I
it's
think that
not.
feels kind of I think that feels kind of confusing to people because I think they misinterpret
It
it. I
should.
think it comes across as you saying it doesn't matter what you eat, so you can go eat processed junk Twinkies all the time. But I don't really think that's what you're saying. I
Right.
think that you're saying that that's,
No,
you
that's
know,
not what I'm
eat a
saying.
good diet, but it's
I'm
like a
saying
teeny
that
part
there's
of it.
no, what I'm saying is the fuel that you put in your Ferrari is not important. It's where you're running your Ferrari is important. In other words, the field that you're on. What you don't realize, the electromagnetic field dictates how gene expression actually happens. That's really the main determinant factor. Where food plays a role is when you are in an altered field. And see, I think Gretchen could probably speak to this a little bit because she and I have talked on the internet quite a bit. What did I say? When you're in an altered field, you have to do extraordinary things in your N equals 1. What's one of those extraordinary things? You have to provide your inner mitochondrial membrane with a very dense current. How do you do that? Well, with foods that are electron and photon dense, with behaviors that are very much outside the norm. Why? Because if you live in Washington, D.C., you have to do extraordinary things. When you walk into the Pentagon and you get migraine headaches, no one needs to tell you that there's a problem. In other words, her observations start to have some sunshine on. The problem is what we're not realizing is not everybody has the type of job that Gretchen has. You know, so when a truck driver gets in his truck and drives from Nashville to San Francisco and has the exact same problems that Gretchen has, he needs to realize that by driving a truck and having a CB in his car puts him at the same risk as it puts Gretchen walking into the Pentagon, or it puts Jack Cruz into when he walks into an operating room, or what Misty Williams goes through as an internet marketer because she's always around Wi-Fi signals. You have to realize it's the field. It's not the fuel. The fuel does play a role, but the role is much smaller than everybody wants to know. And, you know, I'll share this with you. Why do I have a soft spot in my heart for paleo? I pretty much told all of you on my form that we work on semiconduction. The number one semiconductor in our body is collagen. What does that come from? Protein. What does paleo advocate? Protein. That's why paleo makes sense. Short of that, it's an epic fail. What else do you need? You need water, and you need high quality water. What else do you need? You need the other semiconductors. What else do you need? You need to understand about dielectric blockers. You need to understand about Josephine currents. You need to understand about how semiconduction works, because guess what? If you don't, none of it will work. And here's the problem. Every little part counts. Where does cold come in? Well, cold is the one that got everybody interested in what I was saying. Why? People don't realize that current is improved in semiconduction in cold. That's really, you can take down everything I wrote in my book into that one sentence. What you need to realize is you need to increase the current in your body. All life, all health is energy. All disease, all sickness is a lack of energy. And I'm getting ready to show you in several coming blog posts. I can promise you, I can't wait to see all your faces when you read about the elephant and the mouse. Wait till you read about the elephant and the mouse. Something that you knew in third grade, I'm going to prove to you. Everything you've heard in paleo, when they tell you, fat people have excess energy. You've heard Stephen Gwinnett say it on his blog. They have excess energy. I'm going to tell you that quantum physics says he's a freaking moron. It's exactly the opposite. Fat people have decreased energy. Skinny people have increased energy. And it's because they're more energy efficient. And guess what? I'm going to show you using the laws of nature, the laws that are based in things that you know, observations, that maybe I'm right. And it's the reason why an elephant is the size it is, and the reason a mouse is the size it is, and the reason the basal metabolic rate of a rat and a mouse is what it is, and the reason your basal metabolic rate and the reason an elephant's basal metabolic rate is what it is. It's all based on fractal geometry, which is based on evolutionary design. And it's all tied
So
back
we have a
to
follow-up question
Einstein's
here from John.
math.
He said, I would love to have a private consultation with Dr. Cruz and have tried, but he no longer accepts patients. Given my situation, who would he recommend that I go see? It is very difficult having such low testosterone and being so heavy.
Where do you live? Tell me where you live, and maybe I know somebody in that area.
So could you
But
tell him
Dr.
like
Cruz won't
maybe
be
a
doing
kind,
consultations anymore. I kind of,
can you tell him like maybe
huh?
the kind of doctors that he needs to look for? You know, to help him with his situation. I think that's kind of a big one for
Well, the
people is they
best,
don't even.
I would say, well, what I would tell people to do, the smartest thing is to look up for A4M and AMMG. These are all anti-aging doctors that are pretty progressive. They have meetings twice a year, both groups do, and they allow patients to go to the meetings with the doctors. You can sit in, you will meet the doctors, you will see doctors come up to the podium, ask questions, you will hear doctors give talks about different things. You will be able to interact with the doctors one-on-one. It's the only two groups that I know of that allow the public to come in to actually participate in the meetings. Uh, it's very educational for patients. I will tell you that I had 3 educational consultants um, join up on our forum after they heard me talk at an A4M meeting in Hollywood, Florida, when I talked about quantum biology. I mean, people were just floored. The doctors were just like, I've never heard any of this before. And I said, of course you haven't. I said, none of us learned quantum electrodynamic theory and how it ties into anti-aging medicine. But the point for patients to realize is you need to go to these meetings. They won't cost you that much money, and sit there and watch the interaction between doctors. Unless you're brain dead, you'll figure out who kind of knows what they're doing, and you go up and talk to them, buy them a glass of wine, and just start shooting the shit with them. And next thing you know, you may be able to find somebody that can help you. That to me is the best way of doing it. There's other
John
ways.
said he
I mean,
lives
if
in
you try to
Boston.
do it within, well, they have them all over the place. You know, uh, if you live in Boston, there's a lot of anti-aging doctors, but I will tell you, they are exceedingly expensive there. You'll average probably $1,200 to $1,500 a month, and a lot of people can't afford that. I would tell you, you're probably better off spending maybe $1,500 to go to one of these meetings and find somebody, let's say in New Hampshire, Vermont, or maybe upstate New York, who's closer to you that you could collaborate with. But I can promise you, at these meetings, there's at least 500 or 600 doctors from all over the country. And the meetings they have some really interesting angles. And I think everybody who's probably staying up late to listen to me blabber about this would certainly find these meetings very, very educational.
All right. Let's go to a question from Helena. I believe that's how you say her name. How do we optimize our health as a woman who is over 60? I think that's a pretty general question. You might want to get a little more specific, Helena, with something that you're wanting to
Yeah, but you
optimize.
know
I
what?
want to
It's a
skip
good
it.
question. You know why?
Why is that?
Well, it's a good question, I think. I think it's a good question. I will tell you, Helena, here's my advice. Everybody who's been on my forums already heard this, but you probably haven't. When you have an A available, do not settle for a C, a D, or a B. And unfortunately, women over 60 are often given a C, a D by their doc. You have to educate yourself in order to get the health that you want. And I'm going to tell you right now, I'm married to a woman who's much older than me. She's 54 years old, and she now is in better shape today than she was 15 years ago. So here's what I'm going to tell you: don't settle. Absolutely don't settle. Is there a glass ceiling for women in healthcare like there is in business? No, there's not. Women have a bigger upside than men do. The problem is women are more complicated than men. And that's the real reason why doctors don't like dealing with women as opposed to men. I happen to be a little bit of an outlier. If you ask me, I like women more than I like men because I like the challenge. The key problem I find with women is they're not willing and able to do what they need to do. Sometimes they have to make really tough decisions where they have to say no to their family, no to their kids, no to this. Because you know what? I have the belief if you're not good enough for you, you're not good enough for anybody else.
All right. Kathy Lou says, can you summarize the benefits you found after you started using a Magnetico sleep pad? That is, what changed in your labs? She said she's seen a drop in her highly sensitive CRP. And for
Well,
those of you that are interested in Magnetico,
this
by the
was a
way,
long
I'm
time
putting a link
ago,
in
and
the chat
I'm
for you.
only willing to answer. I'm only willing to answer this. I'm almost only willing to answer this question now because the July 2013 webinar gets into it. I did some biohacks over the last probably 3 years, um, on specifically on electric power lines, and I did these in my house. And what I found in these biohacks actually appalled me. Um, I found out that my biggest risk was the outlets on my bed, at the head of my bed by the nightstands. I found that the things that were the most innocuous, that had the lowest amount of milligauss. Let's just put it this way. I'm gonna give you a little hint. I'm gonna give you a preview of the 2013 webinar. A 60 hertz system that's in every single one of our houses who lives in the United States that's listening to this only makes 3 milligauss. Okay, 3. Most people know that the Magnetico sleep mattress comes in 10 Gauss and 20 Gauss. So we're talking hundreds and thousands of factors greater. When I went back and looked at Becker's original data and a Dr. Wertheimer's original data from Denver, Colorado in the early 1980s and late 70s, she found that 3 milligauss was enough to cause developmental defects in offspring. Then it was further backed up in Becker studies. Then it was studied in humans. And 10 years later, what they were criticized for turned out to be true. This was one of the original papers that I was given. If any of you listen to my Jimmy Moore original podcast from, I don't know, 2009 in May, I told people about 6 papers I got. This was one of the papers I got. So I decided to go back and examine for myself what the effect was of the electric field in my own house. And Misty's been to my house in Nashville, and she'll tell you that I had this special room called the man room that was pretty turbocharged. Any guy would love the room. When I tested the room was basically a death trap for me. Uh, I used to watch all my NFL football games there. I would be able to watch every single NFL game at every single time. And yet, when I tested this room and I did my own biohacks, I realized this room put me at not tenfold risk, not 100-fold risk. It was a 10,000-fold risk to me just from the electric wiring that was in the wall. When I realized this pretty quickly, I didn't step foot in that room except to talk to you guys on the internet at certain times. And every time I did that, it made me sicker and sicker and sicker. Um, and I knew it because I was checking my labs. I checked my labs really frequently. The only thing that was able to offset my risk, my N equals 1, was the Magnetico sleep mattress. And it was because it was able to reset my field in my sphere of influence. So every night when I slept on it, it made a huge difference. And I never would have let that slip out, but it slipped out because, ironically, an educational consult I did with Gretchen. Gretchen's like, wait a minute, you need to tell people about this. I'm like, no, I don't want to, because I don't think everybody can afford, a $2,000 or $3,600 mattress. But it is, in my opinion, the only thing that makes a huge difference, because it completely blocks out the 60 hertz power system. Many of the things that you guys heard from Michael Newart in the boot camp series, totally true. But what I know, what Becker found, goes even deeper than that. So what you think is protected, it's not protected. When you
And for
find out what
those that
Becker found out
haven't had a
about
chance to,
the United States Air Force studies in Pensacola, Florida, you'll understand what I mean. Big deal.
for those that haven't had a chance to check out the EMF boot camp, Michael Newart actually spent about 5 weeks with us teaching us how to test our home for all the different kinds of electromagnetic fields and what we could do to reduce EMF in our home environments, office environments, car, that sort of thing. It was very, very educational and gave us a lot of great information. There was so many people in the community after Jack did the EMF series that wanted to know what do we do with this? I mean, how do we make this actionable? So how do we measure our environment, and what do we do if we get high readings? That we brought Michael in to help clarify a lot of those things. So I just wanted to give context for those who might be newer to the community or haven't been able to check out that boot camp yet.
All I can tell you is it was the only thing, Kathy Lou, that actually, when I exposed myself to the room on purpose and got myself sicker is the only thing that reversed it. So for my N equals 1, it was huge. And have I done other tests on all my other family members? Yeah, the number one effect is on the triglyceride levels, which you'll hear about in that July webinar.
All right, here's a question from Elizabeth. How do you typically treat patients with secondary or tertiary adrenal insufficiency, whether autoimmune, hypophysitis, or due to hypothalamic dysfunction? Would the leptin reset work, or would they still need to remain on hydrocortisone for life?
Well, Elizabeth, this is a great question, and obviously, and I don't want to sound condescending when I say this. You clearly have not been reading my blog, and you've not been on the forum. But when I see this situation, when you have autoimmune hypophysitis, I said this today. Pituitary, thyroid, and adrenal glands. It's all about your environment. You live in an environment that is loaded with EMF. You absolutely need to buy yourself a trimeter. You absolutely need to get completely educated about a lot of things Misty just talked about that Michael Newer talks about, because your problem is your field. It's nothing else. And you will never get fixed until you realize that wherever you live, what's going on in your house, whatever it is, it could be a smart meter on your fridge, on your washer dryer, on your house. It could be the Wi-Fi in your house. It could be, your hair dryer that you use every day. You just don't know. But when you have these problems, these are exactly the problems that showed up in the rats, the pigs, and the mice that Becker studied. And they all tie to leptin resistance. You have a problem in your pituitary, your thyroid, or your adrenal gland. It all leads back to leptin.
All right, Kay said, if someone has PCOS and struggles with facial hair, would laser treatment be an acceptable treatment, or is it really detrimental in the path to optimal?
This is a good question because I know where Kay's asking it from. I would tell you to remove the hair, yeah, laser treatment would be good. But let me give you, I don't want to give you the goods, but I'm going to give you something that make you think. If you've been following the blog, and Kay, you're probably another person because the name doesn't sound familiar. You're probably not someone who's been on the blog. Laser treatment is basically tied to the photoelectric effect that Einstein won the Nobel Prize for in 1922. I will tell you that red light laser is one of the fastest, best ways for women to overcome PCOS. Do you think anybody's using that? No, they're not, because they don't understand it. But guess what? Who's using it? Guys like Ben Greenfield and elite athletes in order to overcome intensive exercise. Well, if you understand that PCOS is a generalized stress response at the cellular level because the environment that you live in is loaded with EMF, then you'll start to understand why red light would make a lot of sense. Because red light is the antithesis to blue light. And blue light is what we get from artificial light. It's what we get from this computer we're all watching, from our iPhones, from our cellular telephones, from the environment that surrounds us between the Earth and the ionosphere. Red light has a huge beneficial health effect. Would it help PCOS? Yes. But will you get that type of treatment when you go to the dermatologist to have the excess hair removed? No, you won't.
All right, Nancy says, have you tried using a shungite? I think it's shungite pyramid.
Yes, I've tried that and a whole lot more.
Anything you want to say about it?
I mean, I don't have a problem with it. If somebody said to me, "Is there a benefit?" Yes. This is what I would say to Nancy, because I know where Nancy lives. She lives in Pittsburgh. That ain't going to help you in Pittsburgh. The field that you
What is
live
it?
in
What is it?
Pittsburgh,
What is the shungite pyramid?
not good. Just not good. It's actually a crystal that actually has some beneficial effects on the local EMF environment that you would find yourself in. It actually increases the amount of energy that's transmitted, what we call a spooky distance, um, through all tissues, not only through tissues, but through inanimate objects. Um, it definitely will help. The problem is it's not going to overcome the local environment that we live in. There's very few things that will overcome that environment unless we're doing things extraordinarily well. I mean, the worst, you really need to assess. You need to go back and read the blog post that I wrote about, does where you live really matter? And I'm going to tell you guys, the single number one thing you can do to help your health is you really need to assess where you live. Once you assess that, then the things you do, that's when diet can make a big difference. For example, let me make a real example here. If you live on the 17th floor of New York City in Brooklyn, and you think eating a ketogenic diet is going to help you, you're batshit crazy. The reason why is the EMF environment that is on the 17th floor of a high rise in Brooklyn is equivalent today to having 3 million times the amount of electromagnetic energy that's on the surface of the sun. There is no way your biology can be offset by that. The only way it can, if let's say you were willing to move to a place like Patagonia, uh, or let's say a place like Equatorial Africa, where there's not a lot of EMF. See, their problem there is totally different than our problem here. But see, their field is much more beneficial. They have other problems, but their field, which is the dominant factor for biology, is ridiculously better. I hate to say it, in the United States, people have asked me this time and time again. Is there a great place to live in the United States? The answer is no. If you live in the United States, your life will be shortened tremendously.
All right. Mia asks, do relationships in our lives, good or bad, affect our energy field?
Mia's got a great question. I can see it. Do relationships in our lives affect our energy field? Yes. It's a great question.
You want
Mia,
to
the
expound
answer
on
is
that?
absolutely unequivocally yes. The more negative people you have in your life, the quicker you will succumb.
All right. Elizabeth has a two-part question. Let me read the first part here. I have the tri-field meter and have checked out my house, but don't have too much exposure to EMF. Does this mean I may just be very sensitive to it? I live in a semi-rural Midwest, for reference.
It's possible. There's always two. Yeah, well, if you probably were on our forum, there was a girl on our forum. I can't remember her screen name. I remember her real name, which I'm not going to give you, but she lived in South Dakota. And I happened to sample everywhere in the middle part of the United States before I decided where I was going to live. And I had made some assumptions based on what I knew about quantum biology of where the good places to live in the United States were on a relative basis. And I actually thought that parts of the Midwest were going to be good. And it turned out that most parts of the Midwest are some of the worst places you could live in because there's a geopathic stressor in that area, meaning that there's a huge shale field that's up in Canada that has a runoff that goes almost all the way down into southern Tennessee. That's where it stops. Um, It extends all the way probably from, I'd say, the eastern borders of Yellowstone Park all the way to probably the mid portion of Ohio, straight down. The whole middle portion of the United States is a geopathic stressor, meaning that's not a place that you want to live. It means you're blocking most of the ELF micropulsations that come from the Earth's core and the Earth's magnetic field. Now, the, the converse of that is in the Northeast, where the power grid is ridiculously powerful. There's a corridor from Washington, D.C., all the way up through Montreal, Canada, that I will tell you, in my opinion, is not fit for human consumption. You don't even want to be close to it. Same thing exists portions of California. Uh, Probably some of the safest places to live: Montana, Idaho, Western Washington. But the single best place that I found in terms of testing was around the Gulf region, um, north of I-10, between, I would say, probably Valdosta, Georgia, all the way to about 30 to 40 miles outside of New Orleans. There is no other place in the United States that I think is better than that area. But I want to be clear here. Does that mean that this area is better than any other place in the world? No. There's far better places in the world, but in the United States, that's the place that has the lowest amount of EMF that's present. Uh, the Canary Club, are they reliable? Let's put it this way. I'll make a caveat. I think they're probably better than nothing because I'm a big believer in testing. Um, but no, I can't say they're 100% reliable.
All right. The next question is from Kay. Can you shed any light on what really causes, I don't know what that is, Vitaly, I should know what that is, and how to tackle it? Does slow cooking tomatoes and peppers make it
Vitiligo.
safer for those
It's
with
Michael
autoimmune?
Jackson's disease.
Right. Does it make it
Yeah, I
safer
mean
for
it's
those
an
with autoimmune
autoimmune.
disease?
Yeah, I can say something. I haven't talked about it, Kay, but it's going to be in a future blog post down the road. It's an autoimmune disease that's directly tied to your exposure to EMF. I would tell you specifically to go and read Brain Gut 9 on my blog post. You will begin to understand what I've tried to tell people is there's a reason Michael Jackson died. It's not the reason everybody thinks. Michael Jackson was a very famous entertainer that from the time of 3 years old, he was surrounded by EMS from the music industry. He eventually died because he sought out the care of a doctor who would give him drugs that would allow him to go to a general anesthetic to sleep. And the reason that he could no longer sleep is from the EMS related to his music career. If you know anything about Michael Jackson, he also bleached his skin. Why did he bleach his skin? He had another disease called vitiligo. Vitiligo is an autoimmune disease characterized by a loss of the DC current in the interfacial spaces of your Schwann cells. And trust me, I know you don't get a lot of this, but that's okay. Just remember what I'm telling you. It's directly tied to the loss of the DC current, which is the regenerative current in your body that allows you to heal. What happens? You lose melanin cells in your skin slowly over time. It's exacerbated when you eat a diet that is highly refined in grains, sugars, or polyunsaturated fats that make the situation fast forwarded because your biologic clocks speed up. So, does a diet help? Yes. Will that solve the problem? No. What will solve the problem is to realize that the field that you live in is the cause of your problem. That will help. So you need to get out of where you live and change your diet, and then you can begin to make an impact on this. You'll also have to embrace significant cold thermogenesis to help. And it also depends how far along the process you are. If it's too far gone, you're not going to stop the process. It won't get any worse, but you will not be able to reverse it. Most people, in my opinion, are able to reverse a great part of it if they're willing to do extraordinary things to change it.
All right. John says, I know Dr. Cruz recommends cold therapy. Why do some people like myself crave hot baths and or jacuzzi baths?
That's pretty simple. If you go and read the Hormone 101 blog post and the Hormone 102 blog post, I basically tell people when you've never faced a true winter your whole life, meaning you live the life of a modern human. You have clothes, you have a heated Escalade, you have a heated house. What's the epigenetic signal you just sent through your microtubules in every single cell in your body, through your nerve system, back into your brain? Is that the pilot light is turned off. In other words, you control your own environment. You have to expose yourself to a true winter in order for your brain to realize that there is cold and there is hot. Most modern humans, they have no clue what cold is all about. And that's really what your problem is. When you tell me you can't tolerate cold, that tells me that you've never faced a winter, one entire life, one entire portion of your life. It tells me that your thyroid gland, your free T3 low, your free T4 low, your conversion of T4 to T3 low. What do you have? Something called chronic pregnenolone steal syndrome. And is it fixable? Yes, it is.
All right. That is all for tonight. Jack, thank you for stopping by, greeting us, and answering some questions. I know all members really love hearing from you.
Okay, see y'all around
And a
like a
special
toilet
thank
seat.
you to Gretchen for spending some time telling us a little bit about her story and some of the things that she's learned along the way. We're really excited about this doctors and health insurance boot camp that we've put together for you guys because it has going to have lots of great information and very practical how-tos on things that you can do to immediately start getting some traction and getting the support you need. So hope all of you who can will take advantage of the opportunity to sign up for that boot camp. It is going to be $199 for bronze members, $149 for silver members, and $99 for gold members. So if you have questions about anything, of course, feel free to post to the forums, and we'll be happy to help you out however we can. And I hope you guys got a lot out of this tonight. We really enjoyed putting this together for you. This has been fun for Gretchen and I over the last few months to brainstorm and start, mapping out because we know how much you guys need this help and support. So have a wonderful evening, everyone, and we will see you again real soon. The webinar for this month probably be released by the end of the week, and we will have a Q&A next week for you. All right, we'll see you guys later.